Welcome to the fourth section of your course, where we explore medical emergencies and toxicology. In this lesson, you will learn how to identify and treat a wide variety of medical conditions, from strokes and seizures to diabetic emergencies and drug overdoses. Medical calls make up the vast majority of emergency responses in the field. So your ability to play detective and figure out what is wrong is incredibly important. I am excited to help you master these topics, because developing a strong clinical intuition will make you a highly effective and confident provider. Get ready to dive in as we sharpen your assessment skills for the medical patient. To lock in these core concepts before moving forward, I highly recommend getting our practice tests or downloading the offline app, which are excellent tools designed to test your knowledge in a realistic format. One of the most common medical presentations you will encounter is a patient with an altered mental status. This means the patient is not acting like their normal self, ranging from slight confusion to being completely unresponsive. Because there are so many potential causes, paramedics and EMTs often use the AEIOU TIPS mnemonic to remember the possibilities, which include alcohol, epilepsy, insulin, oxygen lack, uremia, trauma, infection, psychiatric conditions, and stroke. Your job is not to diagnose the exact cause, but to gather clues from the environment and the patient history to guide your immediate life-saving care. A stroke, or cerebrovascular accident, is a critical neurological emergency where blood flow to a portion of the brain is interrupted. There are two main types of strokes, which are ischemic and hemorrhagic. An ischemic stroke occurs when a blood clot blocks a blood vessel in the brain, while a hemorrhagic stroke happens when a weakened blood vessel suddenly bursts and bleeds into the brain tissue. In both cases, brain cells begin to die rapidly, making time the most critical factor for patient survival and recovery. To quickly identify a stroke in the field, you will use the Cincinnati Pre-Hospital Stroke Scale, which is heavily tested on the NREMT exam. This scale looks for three specific signs, starting with facial droop, where one side of the face does not move equally when the patient smiles. Next, you check for arm drift by having the patient close their eyes and hold both arms out straight to see if one arm falls. Finally, you listen for slurred or abnormal speech by having the patient repeat a simple sentence. If any one of these three signs is abnormal, there is a very high probability the patient is having a stroke. Another common neurological emergency is a seizure, which is a sudden, disorganized surge of electrical activity in the brain. The most recognizable type is a generalized tonic-clonic seizure, where the patient loses consciousness and experiences severe, rhythmic muscle contractions across their entire body. Some patients may experience an aura, which is a specific sensory warning like a strange smell or visual flash, right before the seizure begins. When you arrive on a scene and a patient is actively seizing, your main priority is to protect him from hurting themselves by clearing the surrounding area of dangerous objects. Once a seizure stops, the patient will enter what is called the postictal state. During this recovery period, the patient will often be deeply unresponsive, slowly waking up over 5 to 30 minutes while acting confused and exhausted. The brain has just used a massive amount of oxygen and energy, so the patient will likely be breathing very fast to catch up. A major exam tip is to carefully monitor and protect the airway during the postictal state. Providing supplemental oxygen and preparing to suction any saliva or vomit. Moving to the endocrine system. You must understand how to manage diabetic emergencies, which revolve around the hormone called insulin. Insulin acts like a chemical key that unlocks the body cells, allowing sugar from the blood to enter the cells and provide energy. People with type 1 diabetes do not produce any insulin, while those with type 2 diabetes either do not produce enough or their cells resist the insulin. Without the correct balance of sugar and insulin, diabetic patients can quickly develop life-threatening complications that you must recognize and treat. Hypoglycemia, or low blood sugar, is the most common diabetic emergency you will see, and it happens very quickly. This usually occurs when a diabetic patient takes their insulin medication but forgets to eat a meal, causing their blood sugar to crash dangerously low. A hypoglycemic patient will present with an altered mental status, and their skin will be pale, cool, and clammy, mimicking the signs of shock. Because the brain relies entirely on a constant supply of sugar, a rapid drop can lead to aggressive behavior, seizures, and unconsciousness in a matter of minutes. On the opposite end of the spectrum is hyperglycemia, which is abnormally high blood sugar that develops gradually over days or weeks. When the body cannot get sugar into the cells, it begins burning fat for emergency energy, creating dangerous waste products called ketones. This leads to a critical condition called diabetic ketoacidosis, or DKA. A classic exam scenario will describe a patient with a very high blood sugar level, deep and rapid Kussmaul respirations, and a distinct fruity or sweet odor on their breath, signaling that the body is trying to blow off the excess acid. To practice identifying these subtle differences under pressure, reviewing the scenarios found within our practice tests or the offline app can be incredibly beneficial. Your primary treatment for a conscious diabetic patient with low blood sugar is administering oral glucose, a thick gel made of pure sugar. However, there is a strict rule you must always follow, which is a favorite topic on the certification exam. You can only give oral glucose if the patient is fully awake, has an intact gag reflex, and can successfully swallow on their own. If the patient is unconscious or unable to swallow, squeezing gel into their mouth will cause them to choke and aspirate into their lungs, which is a fatal error. Allergic reactions are another frequent medical call, but you must differentiate between a mild reaction and a life-threatening one known as anaphylaxis. A mild reaction might just cause a local rash, some itching, or hives, and does not require immediate life-saving intervention. Anaphylaxis, however, is a severe, systemic reaction that affects multiple body systems at once, causing airway swelling, severe wheezing, and a dangerous drop in blood pressure. To pass the exam, you must recognize that respiratory compromise or the signs of shock are the defining factors that upgrade a simple allergy to full-blown anaphylaxis. The ultimate treatment for anaphylaxis is the administration of an epinephrine auto-injector, commonly known as an EpiPen. Epinephrine is a powerful medication that perfectly reverses the deadly effects of anaphylaxis by forcing the blood vessels to constrict and forcing the constricted airways to open back up. You administer this medication by firmly pushing the device into the lateral thigh of the patient and holding it there for several seconds. You must always monitor the patient closely after giving epinephrine, as it will dramatically increase their heart rate and make them feel anxious or jittery. You will also encounter chronic respiratory diseases, such as asthma and chronic obstructive pulmonary disease, which is known as COPD. Asthma is an allergic or environmental reaction that causes the small airways to spasm and fill with mucus, creating a high-pitched whistling sound called wheezing when the patient exhales. COPD is usually caused by years of cigarette smoking, resulting in permanent lung damage and a constant struggle to move air. Both conditions frequently require patients to use prescribed rescue inhalers, which you can assist them with if their breathing becomes severely impaired. Gastrointestinal emergencies often present as an acute abdomen, which is a sudden, severe pain in the belly area. Causes can range from appendicitis and gallstones to a bleeding stomach ulcer. But your field treatment remains generally the same regardless of the exact cause. You will notice these patients naturally pulling their knees up to their chest to relieve tension on their stomach muscles, a position you should allow them to maintain during transport. You must treat them gently. Provide emotional support. Treat for shock if necessary. And avoid giving them anything to eat or drink. Toxicology is the study of poisons and how they harm the body. Which brings us to the management of drug overdoses and chemical exposures. A poison can enter the body through 4 distinct routes, which are ingestion, inhalation, injection, and absorption through the skin. Your scene size up is especially critical here, as you need to identify pills, needles, or chemical containers before you safely approach the patient. Knowing how the poison entered the body dictates how you will decontaminate the patient and what specific treatments you will provide. Opioid overdoses are incredibly common in modern emergency medical services, involving drugs like heroin, fentanyl, and prescription painkillers. The classic presentation of an opioid overdose is a deeply unconscious patient with pinpoint pupils and severe respiratory depression, often breathing only a few times a minute. Your priority is to manage their airway with a bag valve mask and administer Naloxone, commonly called Narcan, which instantly knocks the opioids off the brain receptors. The exam will remind you that Narcan only works on opioids and is utterly ineffective against other drugs like alcohol or cocaine. Unlike opioids, which depress the central nervous system, sympathomimetics are stimulants that send the body into overdrive. Drugs in this category include cocaine, methamphetamine, and ecstasy. A patient high on stimulants will have a rapid heart rate, high blood pressure, dilated pupils, and often exhibit hyperactive, paranoid, or aggressive behavior. Your primary goal is to ensure your own safety first. Carefully manage their airway and provide rapid transport, as these patients are at a very high risk for sudden cardiac arrest or seizures. Carbon monoxide poisoning is a silent killer that you must be extremely cautious of during the winter months. Carbon monoxide is a colorless, odorless gas produced by incomplete combustion from things like running cars, faulty heaters, or house fires. It binds to red blood cells much stronger than oxygen does, essentially suffocating the patient from the inside out while their skin remains a normal color. A critical exam trap is that a standard pulse oximeter will read 100% oxygen saturation in these patients, giving you a false sense of security. So you must always apply a high-flow oxygen mask regardless of the normal reading. When dealing with complex toxicology calls, you are not expected to know every poison and chemical on Earth. You have a powerful resource available by calling the Poison Control Center or contacting your online medical direction for guidance. They can track exact pill combinations, household chemicals, and industrial exposures to tell you exactly how to treat your patient. Knowing when to ask for expert help is a hallmark of a professional EMT. And exam scenarios will often present this as the safest and most appropriate action. I want to congratulate you for completing this comprehensive section on medical emergencies and toxicology. I strongly encourage you to complete the attached practice tests for this module, or download our offline app to work through flashcards on your phone, as tackling realistic scenarios is the absolute best way to improve your retention and exam readiness. You will find that the practice tests or offline app are excellent companions to this lesson to ensure you can confidently identify these various medical conditions. Keep embracing this active learning strategy, as it builds the critical thinking you need to succeed. Let us carry this positive energy forward and naturally transition to the next section, where we will conquer the fast-paced world of trauma and shock management.